Well, thank you all so much. I'm excited to be speaking to everyone today and to be able to highlight, really what the New Jersey Poison Control Center, what we do, but, more specifically, what we've been doing over the last year. And to remind everyone of our services, just share some of the trends we've seen, during the pandemic and just this changing landscape. Colleen already went over our objectives for today, so I'm not going to belabor that. But I am especially excited to be talking to everyone this week in particular because it is National Poison Prevention Week. So every year, the full week of March, we celebrate Poison Prevention Week. And this week is really dedicated to promoting the importance of recognizing poisoning risks, preventing poisoning exposures, and raising awareness about the life-saving services offered by the nation's network of 55 poison control centers, which provide callers on the through the poison helpline, where we provide callers medical assistance and information, and through our community outreach efforts. So you can see on this map here, the red dots are, they indicate the 55 poison control centers across the US. You can see some poison centers have more, or some states have more than one poison center. Some states or some poison centers serve more than one state. So those little blue and gray dots show you that. But this just shows you each of our poison centers across the US. In New Jersey, I don't know if you could see it on there, but in New Jersey, we have one poison control center. We are the state's only certified regional poison control center, meaning that when you call the poison helpline, which is 1-800-222-1222, anywhere in the state of New Jersey, you should be directly connected to us. We are part of the Rutgers, New Jersey Medical School, and we are, along with the other 54 poison centers in the US, accredited through the American Association of Poison Control Centers. Just before diving into everything, I like to share a few things for people to consider, going into any presentation. Oftentimes when people think of poisons or the Poison Control Center, they sort of have a preconceived notion of, what we do or the things we handle or even, what a poison is. Typically, people don't really think of poisons as being those things that we have around our homes or that we might use every day. But at the Poison Control Center, we simply consider a poison to be anything that could hurt, kill, or make someone sick when used in the wrong way, by the wrong person, or in the wrong amount. So, by that definition, most of the things that we use every day, they do have the potential to become a poison. So according to the CDC, poisoning is actually the #1 cause of accidental injury death in the United States, as well as in New Jersey. It actually outnumbers accidental injury death from automobiles and firearms. That is in large part due to the abuse and misuse of drugs and medications. And although 50% of poison center calls nationwide do pertain to young children, we do see that adults are far more likely to experience a more clinically serious poison exposure or even death. Actually, about 90% of clinically serious cases occur in adults. And adults are less likely to call a poison center for themselves. A kid gets into something and obviously the immediate response is we need to find help. We need to see what the situation is. Adults are less likely to seek help, and they are more likely to experience a more clinically serious outcome. So just to, go over some of our services, the most important one to start with would probably be the Poison Help Hotline. So as I said before, 1-800-222-1222 is the National Poison Help Hotline. So you can call that number anywhere in the US, and depending on where you are, you will be connected to the local regional poison control center. All poison centers, sorry, operate the same way. So, in New Jersey and across the US, we are available 24 hours a day, 365 days a year. Calls are always answered by medical professionals. So either doctors, pharmacists, and nurses who are specially trained in poison information. We at the Poison Center call them SPIES. And these specialists are backed up by clinical toxicologists and even other specialists as needed. So, if we have a call for a mushroom poisoning, we may need to consult an on-call mycologist. We're able to provide information and answers to questions, as well as emergency support. So in an average day, we'll get calls for everything from the power went out and I want to know how long the food in my fridge is going to be good for, to I think my roommate overdosed on her anxiety meds. What do we need to do? And literally everything in between. Calls can be interpreted in over 150 different languages. Many of the members of our staff are bilingual. And we also utilize a language line. Calls are free, they're confidential. And one question I do tend to receive a lot is whether or not somebody needs insurance to call the Poison Control Center. The answer to that is no. The only information that is collected is really the basic information to assess the specific exposure that somebody is reaching out about. And I say reaching out because the New Jersey Poison Center is not only available through the Poison Help Hotline, but we are also available via text and chat. So we have the text number up there, and the chat is through our website, which is NJPIES.org. I understand that graphic is a little bit small, so at the end of the presentation, I actually provide all of those numbers and that information if you'd like to take it down, which I definitely would suggest. Along with the services that are provided through the Poison Helpline, the New Jersey Poison Center also provides a number of other services, including public education. We have a number of educational workshops and lectures. We have educational materials. We do work with Rutgers and other schools in the state to provide internships. We provide professional education. So we regularly have pharmacy, medical, and nursing students doing rotations in the Poison Control Center. We also have a toxicology fellowship program. We regularly release press releases and media advisories based off of any concerning things that we may see. And if anybody is interested in getting on our press release list, I'll provide my email at the end. You can email me directly. Our executive medical director, Dr. Diane Colello, and managing director, Bruce Ruck, are available for interviews by request. And they regularly are interviewed. You've probably heard them on the radio or seen them on the news. And we also provide medical consultations with hospitals and healthcare professionals, more specifically through the Poison Helpline. But approximately 25% of the calls that come into the New Jersey Poison Control Center each year do come directly from hospitals and other healthcare facilities. Along with these services, we are also responsible for the surveillance and management of all poison exposures throughout the state. So everything from food poisoning to drug overdose. Poison centers use a comprehensive poisoning surveillance data system. It's called the National Poison Data System, or NPDS. Each poison center, basically, whenever we take a call, we collect basic information from a caller, basically, what substance the call is about, what is the nature of the exposure, what is the outcome. And this data is all input into our computer system and then uploaded from all 55 poison centers every 8 minutes to the National Poison Data System. And this allows us, especially because the calls that we're getting are coming from people as these exposures are occurring, this allows us to help track exposures as they're occurring in almost, in near real time. And it allows us to help detect, potential public health threats and to alert local and state agencies that may need to know that these things are occurring. It also allows us to become aware of certain situations and to continue to monitor those situations. So just a couple recent public health concerns that poison centers, or that the New Jersey Poison Center has monitored or identified over the last few years. Between 2018 and 2019, the New Jersey Poison Center actually recognized a significant spike in overdose-related suicide attempts amongst preteens in New Jersey. We also have been actively involved with monitoring and assisting with data collection for the CDC for cases of EVALI or vaping-associated lung illness. And we just recently released a press release on this, but we have noticed that over the last 2 years, we've seen a spike in pediatric marijuana exposure cases reported to the New Jersey Poison Control Center, which is very similar to what other states that have worked towards passing recreational marijuana legalization have seen as well. But we did, like I said, just put a press release out about that. And then, of course, obviously, we have been very active in assisting with the response to COVID-19, as many of us have been. We have been requested to take on emergent health hotlines in the past because of our organizational structure, because we're available 24/7, we're staffed by medical professionals. We have in the past taken on many emergent health hotlines. And this usually, it occurs pretty seamlessly. And even with the COVID hotline, it did work very seamlessly into our organization. Obviously, things started out a little bit slow, and I'm going to kind of go through our timeline on this, but calls started out a little bit slower, and then obviously that demand was pretty immediate after, shortly after adopting the hotline. As you'll notice, just off the bat, we do advertise a separate number for the COVID information hotline, which is 1-800-962-1253. And the reason for that is because that 122 number, it is a national number. There were times when especially in the beginning of the pandemic, when call volume was especially high, that calls were being routed to other poison control centers. So that 1-800-962-1253 number does ensure that a caller will be directed right to the New Jersey hotline with a COVID question or to the COVID hotline. It also allows us to ensure that our poison specialists are able to prioritize those poison emergency calls, and that some of our volunteers, as I'll get through to in a second, are able to help out with more of the COVID and coronavirus calls. So in January of last year, prior to any COVID cases in New Jersey or in the US for that matter, it was announced that the state would be launching a COVID-19 information hotline and that it would be run through the New Jersey Poison Control Center. So this is the press release from the governor's office. This hotline was established as a collaboration between the Poison Center and multiple organizations, including the governor's office and the New Jersey Department of Health, along with the help of partnerships with Rutgers New Jersey Medical School, the Rutgers School of Public Health, the New Jersey Office of Emergency Management, and many other medical and public health institutions across the state. The intention of the hotline it was to provide and is to provide accurate, unbiased, up-to-date medical information at any time of day or night, as well as medical support. This hotline is staffed by our Poison Center specialists, as well as our public health staff members. As Colleen said, I have early on was trained on how to take calls and have worked with the hotline very closely. We've also been assisted by medical and public health volunteers from across the state. Just a few weeks into operating the hotline, Senator Bob Menendez held a press conference at the New Jersey Poison Center. It was a collaborative press conference with many groups. And at this time, and when the hotline was first launched, the call volume was still relatively low. But obviously, we did want people to know of the services, that this was available, what they could call about. In the beginning, prior to cases being seen in the state, a lot of callers had questions about traveling to and from certain destinations, or wanted to know basic information about a coronavirus. They never heard of it before, didn't know what it was. They had seen information online or on the news, wanted to know if it was accurate, some safety concerns. But as we started seeing cases in the US, and especially in the tri-state area, we very quickly saw calls skyrocket, and kind of the sentiment of some of these calls sort of change. And I'll go into some specifics of questions, but this is the call volume from early on. That one map may look somewhat familiar from the surveillance slide. That is a typical 24-hour snapshot of calls to the New Jersey Poison Control Center. It's typically anywhere from around 150 to somewhere over 200 calls. On this day, we had received 221 calls at this time in a 24-hour period. The slide on my left, which is a little bit of a bluish color, is it's actually a picture I took on my phone on March 12th. And again, 24-hour snapshot. This was around noon. It's really hard to see up there, but you could see at that point in that 24-hour span of time, we had taken 937 calls, and this was one of a handful of days where our call volume actually went over 1,000 calls per day. So we went from that 200 some odd calls a day to over 1,000 in the span of just a few weeks, or even days, really. You can also see, as I was explaining before, using these GIS maps, you can see the way our surveillance system works. So you can see that early on in the pandemic, especially in New Jersey, a lot of cases were localized to specific areas. And you can see that the call volume is higher in those areas where they were seeing cases at that time. So just a little bit more, in depth about the information hotline. As I said before, it was created with the intention of providing up-to-date, unbiased medical information and assistance. We have still been doing that. We started that in January of last year, and we've been doing that today, and we will continue doing that for the foreseeable future. But we've also been able to provide links to testing locations and resources and services, prevention and public health information and advice. We have been able to help with medical and pharmacologic consultation. So, we've had people call and say, explain their symptoms to our specialists, and they've actually been able to identify when maybe those symptoms are not COVID related. Maybe they're actually a heart attack, or maybe, it's something else and you do need to get to the hospital, or, that is a COVID symptom and they're not very serious. So now is not the time to go to the hospital. We have been able to just as we do with the poison helpline, talk to people about, well, now's not the time to go to the hospital. So we've been able to even help with that. And then, of course, more recently, we've been able to provide medical information regarding the COVID-19 vaccination. So things like side effects or interactions, just as we would with other medications. We've had people call to discuss some of those issues with us as well. Some things just to mention briefly that we unfortunately cannot help with, and we do get callers asking this question, and unfortunately we cannot help with this, but some things, like with scheduling vaccinations or scheduling testing appointments, finding test results, a lot of times we will have people call and ask for locations, and we will have to defer them to the COVID-19 information hub, which is a great resource as well. But those are some things that we would not be able to help people with. People are usually pretty interested to know what kind of questions we've received to the hotline. Like I said, I have personally taken calls myself starting in March, and the last time I took them was last Friday, so all the way through. Some of the questions that we've received, what I've noticed personally is that a lot of these calls, they kind of follow the sentiment of what is going on at the time. They really mirrored what's going on, not only in the state, but also in the country. So early on, a lot of these questions were things like, where can I get tested? Or is it safe to receive mail or packages? What do I do with my groceries? People looking for clarification about restrictions or quarantining, as well as symptoms and contact exposure with a positive case. Those questions really have stayed the same. They've kind of been all the way through. We did see somewhat of a dip in calls over the summer as people were able to get back to a little bit of a sense of normalcy. And then in the fall, as cases started to rise, we saw that call volume spike right back up. And since the fall, and especially later on in the fall into winter, we've seen those call volumes remain very high. So we do see that people are still very concerned. Like I said, those calls, they mirror the sentiment of what's going on. So, over the holidays, people were wondering, is it safe to travel? Is it safe to see my family? I did go see my family, and now someone's sick, and now what do we do? We have had calls from school administrators and school nurses with questions about cases and students, parents concerned about intramural sports. You name it, we have seen it. And our managing director, Bruce Ruck, has worked very closely with the state and the Department of Health and others at the state to make sure that we are able to provide that up-to-date, unbiased information. And even if it's something that we have to take a beat and he's got to check in on it, we are able to make sure that people are getting that correct information and that we're helping them to stay safe. At present, and I made this slide just the other day, we have helped over 95,000 callers. We've actually now helped closer to 100,000 callers. As of yesterday, we were over 97,000 callers. So since the end of last January, 2020, the Poison Center has helped over 97,000 callers to the COVID-19 information hotline. And that is along with the over 50,000 callers that we helped last year from the Poison Helpline as well. Just to get into, some of the things we've seen, obviously we've all seen things change over the last year, and as the Poison Center for the state and other poison centers across the U.S., we've seen some interesting kind of trends in poison exposure, some changes that are related to COVID-19. So I am not going to belabor any of these points, but I did just want to bring up a couple of things. So some factors that we've seen that have led to some specific poison exposures related to COVID-19 would be things like self-medicating, especially based on information that people may see online or social media. Mixing cleaning products and chemicals, mixing the cleaning products and the self-medicating, things were not available in stores, and as some things continue to not be available, people have tried to make their own at home, and we've seen some dangerous side effects from that. Increased quantities of cleaning products and medications in the home. If there's more of something, there's more of a risk for someone to be exposed to it. More time in the home and added distractions. As it said in one of the slides in the beginning, poison exposures are most likely to happen, one, in the home, and two, when people are distracted and busy. Typically, our highest call volumes, or the most common time for people to be exposed to a poison in their home would be in their home between the hours of 4 p.m. and 11 p.m. And if you think of, what you're doing between 4 and 11, you're cooking dinner, you're getting stuff ready for the next day, you're getting the kids ready for school and doing homework and wrapping up work. You're busy, except now it's all day. School's in the home, work's in the home. So we see more poison exposures when people are distracted. We also see that people are exposed to certain things for longer periods of time. We've seen some issues with bias and incorrect information. Like I said, whether it's online, it's in the media, and also some issues related to, just fear of going to the hospital or seeking help when it's needed. Like I said, we've had calls to the COVID hotline where we've then been able to identify this is actually a poison call. And, someone is either they've used something and we need to get a poison specialist needs to be involved. We need to handle this way, or calls where people are actually having a medical issue, like I said, like a heart attack or something of that nature, and it needs medical attention. Just to, again, quickly just go through a couple of the things we've seen, related to those issues. Carbon monoxide and lead. Lead poisoning is always a concern for the Poison Control Center, as is carbon monoxide. There's concern about the potential for rising rates of lead exposure as people are spending more time in homes. If that home, if that home has is contaminated with lead paint, or even if people are, they're doing more recreational products, they may be working with lead. The CDC estimates, so there's actually an article that just came out recently, but that hundreds of thousands of children have missed lead level tests during lockdowns. And are now, many areas are trying to play catch up. I know, in New Jersey, luckily we have great lead programs. We also now see some concerns though with reopening. New Jersey is home to many old buildings, especially in public spaces. So, reopening schools and businesses after these prolonged closures pose concerns where, lead dust maybe have been sitting for months on surfaces, on toys, on, things that are being touched frequently. People are going in and cleaning them up. So, that's a concern. Lead pipes, if there are lead pipes and the water has been sitting there, it's now been months that the lead has had time to leach into the water. So, we want to make sure that people are aware, when we're reopening these buildings, we need to run those taps and make sure that we're wearing the correct protective gear when cleaning, and making sure that these areas are properly cleaned before we have kids and even adults coming back into these spaces. Carbon monoxide, again, another huge problem that we are always, honestly, really harping about is just carbon monoxide safety. Carbon monoxide is a gas. It's produced by common things such as grills, generators, car exhaust, fires. Carbon monoxide poisoning is definitely more common in the winter months and when the weather is bad. So, over the last, obviously now it's been much nicer, but a few weeks back when we saw, all those winter storms coming in, we did see a spike in cases for carbon monoxide. We just changed the clocks the other day. So I implore everyone on this webinar, if you have not done so already, go home and change your, or if you are home, change your batteries in your carbon monoxide detector. Make sure that it's working correctly. It is the only way of detecting if carbon monoxide is present. Early symptoms of carbon monoxide poisoning are very similar to the symptoms you may experience with the common cold, seasonal flu, strep throat, and yes, even COVID-19. And an issue that we see now is as people are spending more time at home, or as we're staying at home, when we're feeling sick more, people are having that constant exposure to carbon monoxide. So carbon monoxide is going to cause these symptoms, these flu-like symptoms, when you're exposed to it. When you leave the area or where the carbon monoxide is, you get that ventilation in the house, the symptoms will typically subside and fairly quickly. So, when we're going to work every day, we may feel sick at home, but we go to work, we come home, we feel sick, we go to work, we feel better. we are able to then maybe, even detect, hey, maybe something's wrong in the home. But now that we're spending extra time in the home, you don't have that time outside where you're escaping the carbon monoxide. So it's more important than ever to make sure that your carbon monoxide detector is working. We suggest changing the carbon monoxide detector batteries twice a year when you change the clock. This way you know that it's working. Make sure that there's a detector on every floor, especially outside of sleeping areas, so that if someone, if there is a carbon monoxide leak, that you can get to a safe area. We also, like I said, we are more likely to see carbon monoxide exposures in the winter, but we do still see them in the summer months. And especially as we're spending, more time at home, or doing less air travel and more car travel, these are some things to just keep in mind. Gas generators when the weather is bad, charcoal and gas grills, but also exhaust from boats. So we always advise, if you're going to go boating, don't swim off the back, swim away from the exhaust pipe. And when you are taking a road trip, never leave that car idling. You might get sleepy, it might be a little chilly. Don't leave the car idling for the heat. That can be very dangerous. And make sure that there's nothing blocking the tailpipes. Cleaning products, like I said, this is something that all poison centers have seen a spike in calls for, and there are a few things that we just want everyone to know. Again, another issue, it's always been a concern. Many people have been trying to make their own cleaning products. This can be dangerous, and if you're mixing chemicals, it also may turn out that it's, they're just not as effective as some commercial cleaning products in killing bacteria or viruses or fungi. Misuse and mishandling issues, and of course, poor storage. If you are going to have extra cleaning products, make sure that they're kept in areas that are safe. And if you have small children or pets locked up, never ingest cleaning products or use them on the skin. And an issue we've seen is people, especially early on, would bring groceries home, specifically, let's say, vegetables, and they would want to sanitize them. So they would stick them in cleaning products in their sink and wash them off. The problem with that is those cleaning products are absorbed into the skin of the produce, and then you are then eating them. So, when you're cleaning food products, make sure you're just washing them with water. You don't need to put any chemicals on them. You would be ingesting them into your body. Anyone you're working with, let them know there is a difference between cleaners, sanitizers, and disinfectants. It's important to know the difference between these products. Cleaners are just simply going to remove dust and debris or dirt from a surface. You scrub and wash, but it's not going to have those, those effective, unfortunately, chemicals to kill the bacteria and viruses. So you want to make sure that you're always reading the label. It will typically say on the label what what type of things will be killed by that product. So, sanitizers will usually lower the number of bacteria and really can only be effectively used on some surfaces, whereas disinfectants, they may be a little bit more harsh, but they will kill most, if not all, germs, viruses, fungi, and bacteria. Another thing you just want to keep in mind, and let the people that you're working with keep in mind, if you have, especially if you have young children in the house, but while we use these sanitizing products more, we need to keep in mind that when I go and wash down a surface and then touch it, that's still, if it's not dried yet, that is contact with that product. They may not be spraying it right on me, but I do have contact when I wipe something down and then touch it. Or you need to be aware of what products, and this goes to mixing cleaning products, know what a surface was wiped down with prior, especially if it's still wet, because that can cause mixing, it can cause these toxic fumes. So mixing cleaning products can really have dangerous, even deadly effects. These are just some byproducts that can be created and some symptoms of these byproducts that can be very dangerous and, like I said, even deadly. We have even seen some issues with hand sanitizer mishaps. Hand sanitizers lead to some concerns because we've seen people, again, they try to create their own and they use unsafe products or substances that are really, can be very dangerous if they're on the skin or ingested. Also, hand sanitizers have very, very high alcohol content, often higher than most alcoholic beverages. So this alcohol content is necessary to effectively kill germs, but these products can be very dangerous if misused, especially for young children. Who might see, so a lot of them, they smell nice, they look pretty, they might want to put them in their mouth. We do also have calls when somebody has intentionally ingested hand sanitizer, again, for that very high alcohol content. We've also seen issues, and many companies have stepped up and helped to create hand sanitizers when there was a lack of it. But some of these companies, they would use these kind of novelty type bottles. This is actually sent to us from one of our fellow educators somewhere in the US. But this was, it's meant to look like a vodka bottle, but it is hand sanitizer. So that's one thing we do always caution against, make sure your products are clearly labeled and people know they're not edible. There also was a very big issue where over 200 hand sanitizers were recalled by the FDA. And the reason for this is that these were mass-produced products. They were found to contain toxic alcohol. So like I said, most hand sanitizers do contain alcohol, but they typically contain a form of ethanol, which is an edible alcohol. It's the same kind of, ethanol is in alcoholic products. But some of these products contained a toxic alcohol that was called methanol. And this caused some, with dermal exposures or exposures to the skin, it did cause some burns and rashes. And quite a few people had to be seen in hospitals if they ingested the product. Again, some children who accidentally ingested it and some who intentionally ingested it for the alcohol content. And it really does, it leads to very serious health effects, and this can even be deadly. Just some quick tips with cleaning products: always wear gloves if possible, use correctly, make sure you're watching children and that they know what things are dangerous, they know where to go. We're locking cleaning products up. Understand signal words on products. So on the label, there will be signal words that can actually help you to determine how dangerous something is. So if something says caution on it, it's usually mildly toxic. If something says warning on it, then it has an increased toxicity. Using it incorrectly, getting it in your mouth or, in your eyes could cause damage. That's usually where you'll see if ingested, contact your poison control center on the label. And then any product that has danger on the label is very highly toxic and very dangerous. And, although all cleaning products should be locked up, you want to look out for those products that say warning and danger. Make sure they're kept out of reach and out of sight of kids. This is just a flyer from AAPCC talking about some cleaning products. Most of our graphics in here are available, and I can provide them to anybody who's interested. Medication, again, increased amounts of meds in the home. It does increase risk for unintentional injury and overdose. I think we've seen more stocking up over the last year than probably ever before. So this has been an issue. We've seen, quite a few places where people are stocking up on meds. Also, with with lockdowns in place and people afraid to leave areas and certain places, let's say, municipal complexes becoming testing locations or even vaccination clinics, people are not able to properly dispose of medications. So, some of those medications that would be dropped off at drop boxes are now sitting in homes. As I mentioned before, self-medicating has been an issue, especially with certain supplements. Online, certain supplements really, kind of blew up as cure-alls or prevent-alls for COVID. Many fake and unproven medical products have been falsely reported to be like saviors for COVID. Although some over-the-counter medications are safe to use to cure, or not to cure, but to alleviate the symptoms of COVID. A lot of these supplements, if not used correctly, can cause dangerous side effects and drug interactions. So it is important. I'm not saying that these are things that shouldn't necessarily be taken. What I'm really saying is that you need to be aware of what you're taking. And if you're taking other medications, make sure that you understand the drug interactions. If there's a question, give the Poison Center a call. And this is actually an infographic we do have available. And then again, just simple tips for med safety. Read and follow instructions on the label. Never share prescription medicines just because it worked for some person or someone doesn't mean it's going to necessarily work for you. It actually could be more dangerous. Definitely know those active ingredients and possible dangerous interactions, especially when it comes to some of these kind of more home remedies. Just because it's organic or a supplement, it doesn't necessarily mean that it's not going to interact with other medications or things that you're taking. Also, again, active ingredients, very important to know. Know what ingredients are in the medications that you're taking. Just one example of something we commonly see and have issues with is acetaminophen is one of the most common ingredients in medications. It's in over 600 different over-the-counter and prescriptive medications, and at high levels or prolonged high levels or mixed with certain things can actually cause liver damage. So again, something to be aware of. Only take medicines, as needed or as advised by a doctor or other healthcare professional. And, most importantly, especially in the Poison Center realm, is store medicines out of reach and out of sight. Locked up is best. With every product, just remember, nothing is actually child-proof. It's just child-resistant. Give it enough time. Willpower, a child will be able to open pretty much any of those child-proof caps. Again, just a quick reminder to wrap up. Like I said, we are available through call, text, and chat. These are the Poison Help hotline. We have our text number up there, and then chat is available through the NJPIES website. I meant to mention this in the beginning and I kind of forgot, but many of you may know the New Jersey Poison Center as the New Jersey Poison Information and Education System, or NJPIES. So njpies.org, that is our website. You can find requests for materials as well as programs. The chat is right on our homepage. All of our press releases are up there, as well as, a whole lot of other useful information. I am going to make sure that these infographics that are included in this are all up there as well. When should someone call the Poison Center? As I said early on and throughout, we are available 24 hours a day. We can provide information, answers to questions, and emergency support. No question is too big, no too big or too small. We are always here to provide free information, advice, and support. When life happens, we have answers. So, we see it all. These are just a couple of different examples. And again, during a crisis, talk to people you can trust. Save the number 1-800-222-1222. Again, it is available all over the US. So, you might be on vacation, you might be hiking, and, come in contact with something dangerous. Also, that coronavirus number, 1-800-962-1253. Did also want to mention, it didn't really pertain to this webinar, but the New Jersey Poison Control Center does also operate the New Jersey AIDS, HIV, and STD hotline, and we have operated that hotline since, I believe, the early 90s. So, we also have that information available as well. I'd like to thank you all so much for your time. This is my contact information if anybody has any questions besides what we have now, and thank you all very much for your time.
Danielle, thank you so much. That was great and really informative. We do have a few questions. So I'll go with the first one. Does the Poison Control Center offer services? I know you mentioned it, there are other languages, but is there someone who can speak Polish or Russian?
So as far as our specific staff, I'm not sure about those two languages, but as I said, we do use a language line. So in the event that somebody calls and one of our staff members who are on at that time does not speak that language, we will utilize a language line.
Awesome. Great. Thank you. The next question is from someone who is very obsessed with cleaning surfaces using bleach, especially after raw meat has been on them. And the question is, if they use a bleach surface cleaner, like on a cutting board, is washing it with soap and water after that enough to remove the toxic levels of bleach on the surface?
You know what? So for that question, so I do have to, just preempt this question by saying I am not a specialist in poison information. I'm a health education specialist. So we would say, anything that's going to touch food, we would say, not to use bleach on it, because especially if you're using, let's say, like a cutting board that's wood or porous, it could kind of absorb that bleach. I would definitely, though, and I hate that I can't provide a full answer to that, but I would suggest reaching out to one of our poison specialists for more information about that question.
Okay, that's great. Thank you. We have several thank yous and several wonderful presentations. So thank you very much for that. I will just ask once more if there's any other questions. At the moment, I think those were the two primary ones that we had.
I also see
Anyone
Kelly McLaughlin, who is with the, my gosh, Kelly, if I say it wrong, I'm so sorry, but the South Jersey Lead Coalition did just put in the Q&A that lead, sorry, I want to say it correctly, but that lead screenings have dropped more than 40% in the state because of COVID.
Yeah, and I think that's probably very common with lots of people have put off preventive care of any sort, so including going for their child's lead screenings, of course. I'm sorry, there is one more question. Does every state have their own poison control number?
No, so 1-800-222-1222 is the National Poison Help Hotline. So that number, no matter where you use it, will connect you to the local regional poison control center. We use that 962-1253 number just as that would be a number that would take you directly to the New Jersey center. I'm sure other centers have numbers like that, but 1-800-222-1222 is the National Poison Helpline.
Great.